Okay. Our first question, Dr. Palasi, is how do we ensure that the distribution reports we provide to our partners, the rural health units, will be included in the report submitted to the Department of Health? How do we ensure the reports?
Pleasant good morning to everyone. Again, before answering that question, I would like to thank Vitamin Angels and partners for inviting me, for on this meeting. Yeah, I think that is a very, very good question. No, we all know that several partners like Vitamin Angels have been participating in the distribution of not only for deworming drugs but as well as nutrition services and uh, how can we ensure how that the part of the accomplishment of the partners whether local or national development partners would be included uh, to tell you honestly, this had been actually the bottleneck as far as the recording and reporting of the program because uh, usually we receive already the report to the national level coming down from the regional offices in an aggregated manner, and we are coming out now with a mechanism on how to disaggregate it at the lowest level. Most especially, I think would be most suitable at the barangay level, no, because this is actually the lowest service delivery point or implementing unit. But in reality, you can, if you will go down at the local level or at the RHO at the barangay level, there is no recording form, no, as far as contribution of partners are there, no, because it is just a summary of reports or information, no, and the program is discussing now, and recently we have actually developed our monitoring and evaluation field guide, no, and we are updating that to include some uh, processes and mechanisms that would address the reporting of various partners of the accomplishment of the program. So I just like to tell you honestly that as to date, we do not have yet a way, but we are in the process of coming out with that process or mechanism to include reports from partners. Thank you.
Salamat, Dr. Palasi. We have a follow-up question for you from Dr. Edita Miguel from the Agape Rural Program. How can we ensure that there will not be double reporting? How can we assure that our data is one time lang po, hindi po nakakount ng doble? Would you like to comment on this?
Yeah, these are operational issues. Yeah, in the reporting, no, and I think it's related to what I have said a while ago that when we come out with a mechanism or process to include the accomplishment of various partners, we should also see to it that the reporting mechanism should not be duplicated. No, this would basically go down, no, to the reporting forms, no, that would be used, and uh, specifically, if you will come out with such reporting forms that make sure that there should be a separate columns, no, or rows for reporting coming from various partners as well as those reported by the government. So I just like to say that again, we will take note of that. No, as I mentioned a while ago, we are discussing and talking this mechanism so that partners' involvement and accomplishment will not be put it waste, but rather to be included in the accomplishment to the government.
Okay. Okay. Salamat po. We have another question. Dr. Palasi, will the DOH continue to supply the worming tablets or transfer to other countries?
Yeah, I think that is also an
What is the timeline?
yeah. Thank you for asking that question because it is a very interesting question, and it has something to do actually with the implementation of the Mandanas case. No, I suppose that most of our partners are aware, no, of the Mandanas case, wherein there's some sort of redevolution, no, of some of the services of the Department of Health going to the local government, no. But for now, for the deworming drugs, no, and other population-based services, no, uh, because we are following, no, there's a provision in the universal health care that population health services like deworming or mass drug administration should still be supplied, no, by the Department of Health, no. So just like to assure you at this point that the national government will still take charge, no, in the procurement as well as the supply and delivery of these drugs to the various local government as well as partners. Thank you.
Okay. From the follow-up po from Dr. Edita Miguel, Doc, are there researchers on worm resistance to albendazole like in other countries? Do we have researchers on that, on the resistance to albendazole?
Yeah, that is also an interesting question, no, because these drugs that we've been using for deworming has been there for so long, no, it's more than decades already, and this is actually a concern, no, resistance to these deworming drugs because uh, there are some studies in other countries, particularly in sub-Saharan Africa, that despite the rounds or a series of deworming campaigns that they've been doing, that the burden, no, or the prevalence of states is still there, no. So the WHO, in coordination with other technical partners, consulted the DOH to come up with some sort of study, no. We call this the efficacy study, no, to determine really what's the status, no, of these the deworming drugs that we've been using, no. But for now, I can still assure that as far as the Philippines is concerned, I think it's still effective, no, for us. But of course, we are not complacent about that, no. That's why we are coordinating with WHO to conduct this so-called efficacy study to really determine the real score. Thank you.
Salamat po, Doctor. Uh, Another question po from Georgia Makad from the Abundant Grace of God Paternity Center in Kalinga. Ang question po is, can I ask, how are you able to determine the rates of people affected by parasites in the deworming drugs?
Sorry, sir. Uh, Pardon me. Can you kindly repeat the question? There's some sort of interruption in the question.
Hello, Dr. Winston. Just to continue the question fielded from Miss Georgia Macad from Abundant Grace of God Maternity Center in Kalinga, how are you able to determine the rates of people affected by parasites? Are you relying on the LGUs to report their cases?
Yeah, that I think that is also a very interesting question. No, but for now, we are using community-based surveys. No, we call this the prevalence studies, and there are partners to determine, no, the rates of infection, no. It's not only the academic but also the our national laboratory, no, the reference laboratory, which is called the Research Institute of Tropical Medicine, have been conducting periodic, no, and regular prevalence surveys, no. Well, the report no is not so much reliable, no, because what they have been reporting is just the accomplishment as far as preventive chemotherapy or deworming, no. But if we really want to know the status or the burden of the rate of infection, it's better to do some community-based surveys like prevalence studies. Thank you.
Okay. Thank you, Dr. Winston. We have another question from the Assisi Development Foundation from Ma'am Florinda Lacanlalay. How do you encourage the parents to have their children dewormed because of fear caused by negative news in some schools that had mass deworming? Is this still a concern?
Yeah, I think thank you again for that question, and thank you for bringing that out, because I agree with you that there are still hesitancy, no, in some areas in the Philippines who do not like to participate in such activities. It's not only deworming, but of course the other public health programs like immunization and so forth, no. And I think we have a very big role, no, as stakeholders here, no. Our development partners, the local government who are our direct contact, no, or are directly involved in the provision should step up, no, in really raising the awareness, no, in consciousness of our partners, no. I just like to say that and ensure you that the drugs that have been using are safe and effective, because this had been used, no, and in many countries all over the world, no, and it has already been for decades, no. Well, of course, this is different if the drug that you are using is novel, but this has been already been used, no. Noon pa, no. If you recall, nung bata pa tayo, when we are in the elementary school, no. Pag maalala yun, nagpupurga naman tayo, no. We have been encouraged by our parents and our teachers to participate, no. So I think that the local government as well as partners should really continue to raise the awareness and consciousness, no. Ang paniniwala ko is yun lang po talaga yung makakatulong sa atin, yung pagbabago po ng behavior ng mga tao to address this, no. And I think it's very important to explain to them, no, that the importance of deworming, it's not only to improve physical health, but it has also to do with mental affectations or school performance, no. Kasi sinasabi nga natin dito that ano ba itong batang to, ang bobo-bobo, pero we're not realizing that it's not only due to the physical health that's being affected, but also the mental health, no. So those are the things, no, that really we have to emphasize when we're doing such health education. And I say that whether we like it or not, we have to continue such health education.
Thank you, Dr. Winston. So it's really a matter of education and awareness po talaga, no? And with the help of our NGOs to reinforce our beneficiaries to get their children dewormed. Doc, we have another question from Mr. Orlen of Feed the Children. What are the parameters in measuring the impact evaluation, both quantitative and qualitative data, aside from health improvement and behavioral changes?
Yeah, well, for the measuring the quantitative, of course, we rely to the quantitative indicators like the prevalence or the rate of the infection. But for the qualitative, which is really more on the knowledge, attitudes, or the behavioral, no, there are several studies that was uh, done by our ITM, no. We call this the ethnographic studies, no. And I would like really to share with you, no, later on these studies, and you can observe, no, that there are different parameters as well as results that our ITM did, no, and doing this ethnographic study to measure the qualitative aspect, no, of the program.
Sir, we have another question naman po, no? Does the MDA coverage report include all target areas, meaning including preschool age children and school age, and other target populations?
Yes, yeah. For now, our regular reporting would be from the at-risk group of preschool age children as well as school age children. But for the other vulnerable groups like the women of childbearing age, pregnant women, indigenous peoples or communities, as well as those in the paramilitary, I'm sorry to say that we have erratic reporting, no? Meaning to say na hindi maganda eh. Hindi maganda yung reports that we are received because reporting units either want to report or not, no? So it's some sort of intermittent, no, and erratic, no. But for school age, preschool and school age children, we are receiving regular reports.
Sir, just a follow-up question to that, no? Given the current situation with the pandemic, has this also affected the reporting of data for the program?
Yes, yes ma'am, definitely, no. If you will observe po yung pinakita kong accomplishment, no, one of the factors also is the difficulty, no, in the submission of reports. So probably that some implementing units have not done their deworming campaign because of the COVID pandemic, or uh, there is also difficulty in gathering from the lower level up to the province to the regional, coming up to the national. No, so the pandemic has really affected, no, the reporting as well.
Dr. Winston, we have one last, okay, we have a couple of last questions, no? As a follow-up to the resistance study raised by Dr. Edita Miguel, Mr. Bernie of with Love Jan Foundation asks if this can be if it can be designed like a clinical trial where the reporting of data is completed online.
Um, I am not sorry to say this, but I am not familiar with the project design and methodology. No, actually, I have not yet read the protocol because it's still starting as a discussion with partners as well as the academic, no, WHO to conduct the study. No, but surely I will send it to our to Dr. Luz and Ma'am Irene, no, the protocol, so that you can come up with some sort of comment or input, no, and we welcome that, no, we appreciate, no, if you can give also your inputs to this.
Okay, thank you, Dr. Winston. We'll coordinate with you on this. Sir, in relation to the question on the measurement of impact, no, both quantitative and qualitative, follow-up question from Convoy of Hope Foundation from Mr. Luis Jr. Sasuman. What are the mechanism in place to ensure integrity of data or maybe a means of verification?
Yeah, I think that first we would like to assure you that the data is good, no, it has integrity because we are outsourcing it, no, to outside of DOH, no, we are tapping the academ as well as the RITM who have been, I think, established research institutions, no. They have been doing already several studies, no, and we all know that the academ, no, is very familiar, no, and have been doing such studies in skillful manner, no. So we are confident, no, by outsourcing this we can come up with a reliable data. Thank you.
And one final question, Dr. Palasi, from Dr. Edita Miguel of Agape Rural Program again. Is there a comparative analysis of nutritional status with compliance to the deworming program?
Yeah, I think I have seen one study that was done by the Food Nutrition and Research Institute of the Department of Science and Technology, no, some sort of comparative study of deworming as well as the nutrition, no, but again, I'm sorry to say that I'm not familiar with the study, no, but I think there's some correlation, no, as far as deworming and nutrition in that particular study. uh, Again, I would like to give, no, this study to Dr. Luz as well as Ma'am Irene so that you can further study it. Thank you.
At this point, no, as much as we want to entertain all your questions, we really have to move forward with the program. Thank you very much, Dr. Winston Palasi, for all the insights that you shared with us this morning and for helping clarify concerns of our program partners. Thank you.
Maraming salamat po din, ma'am.